Good morning, my name's Alondra, and today we're going to be talking about seizures. First of all, what is a seizure? A seizure it's an episode of involuntary muscular contractions and relaxations. It's often accompanied by sense, changes in sensation, behavior, and the level of consciousness. So we're going to be talking about two kinds of seizures. The first one would be the partial seizure, and the second one would be the generalized seizure. For the partial seizure, there's two kinds. There's the simple and there's the complex. What is the partial seizure to begin with? So it is a seizure that attacks a specific area of the brain. It creates the abnormal activity, and then the generalized seizure targets the whole brain. In a simple partial seizure, the symptoms would be awake and alert, but the seizure will not last longer than 2 minutes. Usually when this happens, the patient has no recall of this seizure. They're unaware that it even happened. So when it comes to complex partial seizures, the patients usually have a glassy stare, an involuntary muscle contraction, they're fidgeting with clothes, they have aimless wandering, and they also have lip smacking or constant touching of the mouth. The seizure should last less than 5 minutes, because if they do go into 5 minutes, then you would have to call 911, make sure you get help, because this would mean that they could go into status epilepticus. So things to know about a generalized seizure. So first of all, it consists of 3 parts, and the first one would be the tonic phase, the clonic phase, and the postical phase. So your generalized seizure is also known as a tonic-clonic seizure and as the grand mal seizure. For the tonic phase, the symptoms would be rigid muscle contraction, sinuses around the mouth. The patient also tends to lose the control of their bowels, which can cause urination and defecation. And this tonic phase can last up to 30 seconds. So after the tonic phase, we have the clonic phase, and the symptoms would be the patient's jaw locking, which you should be careful about. We need to make sure that you put them to the side, you turn them, because when their jaw locks, it can cause them to bite on their tongue or their lips. And also their body jerks violently. After the clonic phase, we would have the postical phase. And this phase can take up to 30 minutes, so it's usually from 10 to 30 minutes. In this phase, this is when the patient is coming out of it. If they usually have no recollection of the seizure, they're just confused, they can have a massive headache, they can seem disoriented, but this doesn't mean that they didn't come out of the seizure. Patients with epilepsy might sometimes perceive an aura. And what is an aura? It can be a sensation that something's going to happen, which can be a taste, a smell, a feeling, a sound. Sometimes it can be twitching, can be exciting. And when this happens, usually the patient will alert you. That way, if they are on seizure medication, you can make sure it's getting to them properly, and you can make sure they are eating right and doing everything they're supposed to be doing. Sometimes the patient can sense an episode coming up to 2 days.
It is important for us to recognize the seizure triggers. A lot of people memorize these by using an acronym called STOP seizure. These would be stress, trauma, overexertion, period, pregnancy, sleep loss, electrolyte and metabolic issues, which would be hypoglycemia and dehydration, illness, visualization disturbances, which would be sounds or smells, and under medication, recreational drugs, as well as alcohol.
What to do during the seizure, you just gotta make sure that your patient feels comfortable. Make sure you lay them flat. You turn their head to the side. You turn their body if possible. Do not block their airway. I know a lot of people still believe that you're supposed to try to insert something in their mouth to prevent them from choking on their tongue. This is not gonna happen. You just want to turn them to the side so that way you can clear their airway in case they do have any bodily fluids coming up, like throw up or saliva or blood. It goes down the side. And also you want to make your patient comfortable, which means that if there's a crowd around you, you just got to make sure that the people keep moving, because you never know how your patient might react when they wake up. When it comes to how to prevent a seizure, there's really nothing you can do but make sure that your patient is taking their medications. And for after a seizure, you just gotta help your patient through, make sure they regain their consciousness by asking them a couple of questions. Sometimes it's good to take their vitals, and you gotta watch for that time frame. So make sure a seizure does not last more than 5 minutes. This is very important. So you want to make sure that seizure does not go above 5 minutes, because then they go into what is called status epilepticus. So during this status, you would have to make sure that they are in the hospital, mostly because this requires treatment.